When someone is diagnosed with cancer, life changes right away. Most people think first about the patient, but there is another group that is deeply affected: caregivers. Caregivers are often family members, a spouse, a partner, an adult child, a close relative. They provide care every day, often without training, often without rest, and often without support. In this video, I'll talk about caregivers of people with cancer. I'll talk about what research shows. I'll talk about why caregivers matter, and I'll talk about what support caregivers need. This video is based on a peer-reviewed editorial published in 2024 in the Lancet Oncology. It brings together research from several studies around the world. Everything shared here is for education only and does not replace medical advice. Who are cancer caregivers? A caregiver is someone who helps a person with cancer in daily life. This may include going to medical appointments, managing medications, helping with bathing or eating, providing emotional support, handling finances and paperwork. Most cancer care does not happen in hospital. It happens at home, and most of that care is provided by family. Caregiving is not just a task. It is a role that affects the whole person. The hidden impact of caregiving. Caring for someone with cancer takes a strong emotional and physical toll. The research shows that caregivers often experience chronic tiredness, headache, digestive problems, muscle pain, weight changes. These are physical effects, but the emotional effects can be just as serious. Many caregivers report ongoing stress, anxiety, depression, social isolations, trouble concentrating, fear and guilt. Some caregivers feel they must always be strong. They may hide their own pain. They may feel they do not have the right to struggle. But struggling does not mean failing. It means the burden is heavy. Quality of life often declines. The editorial highlights a 2024 study from Morocco. In this study, family caregivers of people with cancer reported low quality of life both physically and emotionally. The decline in well-being was linked to factors such as age, gender, employment status, marital status, relationship to the patient. These findings are not unique. Similar results have been found in many countries. This tells us something important. Caregiver stress is not rare, it is common, and it is often overlooked. A serious and alarming finding. One of the most serious findings discussed in the editorials comes from a large study in Denmark. This study found that spouses of people with cancer had a higher risk of death by suicide compared to spouses of people without cancer. The risk was highest during the first year after diagnosis, when the cancer was advanced, when the patient later died, when caregiver had lower income, when there were no shared children. The risk was especially high when the patient had cancers with poor survival, such as pancreatic cancer, lung cancer, brain cancer, esophageal cancer. This finding is deeply concerning. It tells us that caregiver distress is not just about emotion, it can be life-threatening. Why caregivers are often overlooked. Caregivers are often invisible in healthcare systems. Medical visits focus on the patient. Caregiver may sit quietly in the room. Their needs are rarely assessed. Many caregivers report little preparation for the role, little education about what to expect, little emotional support. Yet, their health directly affects the patient's health. When caregivers are overwhelmed, care quality can suffer. Treatment decisions become harder. Both patient and caregiver outcomes worsen. Supporting caregivers helps everyone. Cancer care must be family-centered. The editorial makes a clear point. Cancer care should not focus only on the patient. It must include the caregiver. This is called family-centered care. Family-centered care means recognizing caregivers as part of the care team, screening caregivers for stress, anxiety, and depression, offering support early, not only in crisis. Some countries are beginning to move in this direction. For example, Morocco's National Cancer Plan includes support for caregivers, not just patients. This shows progress is possible. What healthcare system can do? The editorial recommends several important actions. Health system should include caregiver health in cancer care plans, use screening tools to assess caregivers' well-being, coordinate care between cancer teams and mental health professionals. One example is a simple questionnaire called a Family Reported Outcome Measure. This tool helps identify when caregivers are struggling. Early support can prevent long-term harm. The role of healthcare professionals. Doctors, nurses, and other providers play a key role. They can ask caregivers how they are coping, screen for stress, anxiety, and depression, provide education and clear information, refer caregivers to counseling or social services. Oncology nurses in particular are in a strong positions to help. They often have close contact with families. They can offer guidance, reassurance, and connection to resources. Caregivers need emotional support too. Caregiving often involves fear of loss, fear of making mistakes, fear of the future. The editorial notes that psychosocial support programs can help caregivers cope. This program may reduce distress, improve emotional resilience, help caregivers adapt to ongoing challenges. Support does not erase pain, but it can make pain more manageable. A message for caregivers. If you are caring for someone with cancer, this message is for you. You are not weak for feeling tired. You are not selfish for needing rest. You are not failing if you feel overwhelmed. Caregiving is hard. Your health matters. Your feeling matters. Your life matters. Asking for help is not giving up. It is protecting yourself. A message for families and communities. If you know someone who is caring for persons with cancer, check in with them. Listen without judgment. Offer practical help. Encourage rest and support. Small actions can make a big difference. Cancer survival is improving. More people are living longer with cancer. This also means more caregivers are needed. As numbers grow, caregiver support can no longer be optional. The editorials make this clear. Caregiver must be seen. Caregiver must be supported. Caregivers must be protected. Cancer affects more than one person. It affects families, it affects caregivers. By recognizing caregiver needs, by offering emotional and physical support, and by building stronger care systems, we can help both patients and caregiver live with more dignity, strength, and hope. This video is for educational purpose only and does not replace medical advice. If you are a caregiver and feel overwhelmed, please speak with a healthcare provider or mental health professional. Thank you for taking the time to listen.